Welcome back this morning. It's 6:22 on your Thursday, and it's an issue that has been dividing people across the state, whether people should be required to wear a face mask.
Now, Governor Jay Inslee is announcing plans to start easing some of the COVID-19 mask mandates. In just 8 days from now, starting next Friday, outdoor mask mandates will be lifted. But what about the indoor mask requirements? Here's what he had to say about that.
Today is not the day to lift all of the masking requirements. We are obviously having conversations and an intensive review of what day it will be and when we can do this. It is no longer a matter of if, it is a question of when.
Meantime, there are some school districts across the country that are lifting the masking requirements for students. And now our state school superintendent is weighing in on what he'd like to see happen here in Washington.
As you can see, State Superintendent Chris Reykdal joining us live here on King 5 Mornings. Thanks for getting up with us this morning. So many questions. Let's start here. What is your recommendation to the governor when it comes to lifting the mask mandate in our schools?
Good morning. My recommendation is that they sort of expeditiously get through their data. These things take a long time. There's a big lag time. And so my recommendation isn't for an immediate removal. It's for the Department of Health and the governor to review the data. Cases are coming down dramatically. Hospitalizations are down. Vaccination rates are up. And the ongoing nature of the tension around this is just changing the variables. So I'm asking them to review it, to ultimately make this a mask optional policy. Local health officials, of course, can always intervene. They have had that authority for decades in our state. But a universal statewide mask mandate needs to come off now.
Yeah.
So right now, though, the CDC still recommends universal masking for students. What evidence is there right now about whether these masks actually help to stop the spread of COVID in classrooms, and how is that impacting what you're recommending?
Yeah, I think there's ample evidence that masking, particularly when we didn't have vaccines and we didn't have significant immunity as a result of infection, was the best tool and strategy that we had. And there are still settings where that's obviously very appropriate, where loss of life is high risk, adult care centers, acute healthcare facilities. The question is, do the benefits outweigh the risks now as we get more folks vaccinated? And what we've seen is just growing tension in our schools and a lack of relationship building in many places, because that mask serves as a bit of a barrier. It's clearly a barrier when it comes to speech therapies and language development. So it's that 2 years ago, there was no question this was the right thing. And now has the chemistry of all of this changed? Has the mix of the cost benefit changed? And I think it has, to the point that we can now remove masks as a universal mandate and still be very, very safe.
There is another side to this, though. Of course, the teachers being, subjected to maybe a more risky environment. I think we can all agree that the masks, as you mentioned, have had an issue on some of the socialization in our schools, the learning. But are we risking staffing shortages potentially if these masks mandates are lifted and we're going back to just closing schools again because of a staffing shortage?
Yeah, it's a powerful question, Jake, and I don't think so. What we've seen in the last several weeks as Omicron really peaked and started to fall is we never had more than 4% of our buildings having to close on a temporary basis as a result of infections. And it was generally adults, but we've gotten through that and we're back in person again everywhere. And so I think the question going forward is, was there enough infection with natural immunity? Was there enough vaccination? And clearly in a state like ours, that's very much becoming the case, especially in the Puget Sound. So I don't worry about that as much. And I'm not recommending we get rid of masks. I'm saying move to a mask optional policy. And I suspect that a lot of our professionals will want to keep that, even though they are vaccinated and boosted at really, really high rates. They should always have the right to maintain a mask if they want to do that.
Yeah, and with that too, I mean, there isn't a lot of evidence that supports the fact that schools are centers of outbreaks in the community as much. So a lot of that has to do with the on-site testing and so forth. Is there going to be an effort to make sure that schools can keep that on-site testing and the tools they need to clamp down on any outbreaks if they do happen?
That is part of my recommendation, is that we move from really broad asymptomatic testing to focusing those resources on those who are symptomatic in schools, whether it's a staff member or student, and then go through our quarantine and isolation process so that we quickly tamp down on any risk. We have that ability now that we didn't have 6 months ago even. And so again, that's one of those variables that makes me believe we can remove masks and really enhance the learning environment and do it in a way that is safe. And rapid testing is one of the real powerful strategies.
Well, I know there are a lot of parents who are listening to this interview right now, kind of cheering, listening to your recommendation, but also some parents who are really nervous about this idea. So the debate continues, of course. Superintendent Chris Reykdal, thanks so much for your time and for a chance to explain this on live TV.
Great, thank you.